Welcome to one and all to yet another interesting conversation on ETHealthWorld. Today we have with us Dr. Anna Van, the Global Head of Healthcare KPMG International, who would be sharing her views on how the COVID-19 pandemic has become one of the biggest health emergencies faced by the global health community, affecting not only the health systems across nation but also the economic structures. Dr. Anna will also be giving us insights on how India has to navigate through the pandemic and a myriad of other challenges by undertaking strategies to balance both the health and the economic stability of the country. Thanks for taking out time and speaking with ET Health World. Welcome, Dr. Anna.
Pleasure to be with you.
Yeah, so to begin with, I would like to ask about the global workforce crisis in healthcare. And World Health Organization has projected a global shortage of 18 million health workers, and healthcare is one of the largest sectors and employers in the world. So what can be done to bridge this gap? And particularly when we talk about in India, we have to provide adequate healthcare for 1.3 billion people in India by 2030. So what kind of solutions you think can be workable? Over to you.
Yes, that's a huge challenge. And actually, it's what you were saying. India is having a workforce problem in healthcare, but it's not only India, it's also the rest of the workforce problem in healthcare is a real global one. And that's due to a number of reasons. I mean, due to the aging population and younger people getting into, having less younger people, we have just less workforce to choose from. And secondly, you see that the COVID-19 crisis has hit severely hard on the workforce. I mean, frontline workers dying, frontline workers being burned out, the stress, even traumatic situations, and that has really affected. So we need to reboot and rebuild the workforce. And that's a challenge that everybody feels. I think there's a number of ways of doing that. First of all, what is very important is we need to start making the profession and the sector attractive again. And attractive means thinking about what can we do to help them in the problems that they had due to COVID. Mental health, but also giving them time to rest, but also thinking about working conditions. So that's first of all. Secondly, what we need, and that's especially for India, I mean, with the growth of the population, I think there's only one thing to say there, and that is educate, educate, educate. Medical institutions, I know that ARMS and some others are really wanting to spread out their educational efforts. I think that that's crucial to do that. But it won't be enough in itself, because your risk, of course, is also losing doctors and nurses going abroad. So rethinking about how can we keep them in the country, what needs to be done there. And you can think about, housing for them, other conditions that can make it attractive. And then I think it's also starting, and you see that happening worldwide, starting to think more creatively. Digital can be very important. Digital can help replacing manual work by digital work. So reducing the need for doctors or reducing the need for nurses, because you can digitize, especially the administrative work can be digitized, saving a lot of time. And then what we see worldwide is digital learning, e-learning. Just imagine that you can skill and reskill and upskill your workforce by using e-learning, bringing it to remote areas. That's a very important element as well. And the last one is allied workforce. So what we see is that in workforce, it's not only the doctors or the nurses who are important, but I think especially in the tier 2 and the tier 3 cities and the rural areas, we can, through e-learnings, through digital communications, we can upskill our allied workers and really help them in doing more and taking more of the responsibility. One example here is nurse practitioners who can function just between doctors and nurses. So I think we need to be very creative and have a very good, strong, coordinated effort in India, worldwide, but in India certainly. So those are some of the things that I'm seeing and some of the advices I would give to the sector.
Great. Yeah, we need a lot of creativity and we need to bring in a lot of newer things to it. So when we talk about bringing in new things, so my next question to you is like how COVID has leaped from the importance of digital health. A lot of digitization is happening. Telemedicine is like gone, leaps and bounds. So what digital forces will drive healthcare transformation and how it has become indispensable due to pandemic and how we are going to take it forward?
Yeah, it's definitely true that COVID-19 has driven the digital transformation. We interviewed 200 CEOs from health system worldwide, and more than 2/3 said that digital and the digital strategy is key in order to address the challenges in the coming years. And I think we can start talking about a digital tsunami after COVID. The public start accepting that healthcare can be delivered for a great part digitally. The professionals, doctors, nurses started accepting that. So that makes it easier. And actually, we saw in a number of programs worldwide that we were doing digital programs pre-COVID at very ambitious targets. And being 2 months into COVID, we had excelled them all. So that's sort of saying what is happening here. Now, what is going to be key here? What is going to be key here? And I think I'm looking at India here. I think there's a lot of public-private entrepreneurship. MedTech is stepping up its game to develop new apps, to develop new approaches. I know that a lot of the medical institutions here in India, like IMIS, but also the global hospitals, has the willingness to cooperate between life sciences, MedTech, the healthcare industry, and others to digitize healthcare. So it's building the tooling. But behind it, of course, we need to start thinking about interoperability. So the biggest issue we can create is digitize healthcare, but do it in a way that's totally siloed and where primary care doesn't speak to secondary or tertiary care. It needs to be interoperable. And I think also it needs to be, the data infrastructure needs to be good. So the exchange of data between the different participants and the different providers, but also the exchange of data so that we can help creating things like the National Health Observatory. Because in the digitization of healthcare, we very often think, and that's going to be important, telemedicine, remote monitoring, remote consultation. But one very important aspect there is having using data to have a much better view of where are your vulnerable populations? Where are your critical cases? Someone is developing diabetes. Can we intervene at an early stage? So I think that National Health Observatory and that data pool and bringing that to the forefront is also going to be key in shaping the digital future in healthcare.
So when you're talking about the digital infrastructure and how interoperability should be more robust, what are your thoughts on India's unified healthcare interface, which we have started, the central government has started? So this open network designed to actually enable the interoperable digital healthcare service delivery, like teleconsultations, also putting PHCs and tertiary care and taking it to tier 2, tier 3 cities into the rural areas. Can you share what you think this would entail and how it's going to circle around maybe in 2-3 years?
Yeah, I think actually what I admire very much about the transformation that the Indian healthcare system is going through is the combination of government's role, regulation, new financing, and the entrepreneurship that we see in the Indian environment. That's actually worldwide, that's a very unique characteristic of India. Now, that's great, but you need to keep combining that in order for your digital mission to be successful. So, like I was just saying, the biggest risk that you can have is have siloed system and apps that don't communicate together. And patients, you have diabetes and you have a choice between 13 apps and you'd start thinking, which one am I going to use? So, for example, that Ayush Bharat digital mission and bringing that to the last mile is very important. And what is a very important key in that interoperability is that medical unique identifier that you are creating in India. Because having that means that you can start connecting data. And that's actually when data becomes very rich, is when you can start connecting it. That's very rich for research purposes. That's very rich for determining what are the social determinants of health and who is at risk. But it's also important for doctors and patients and nurses because there they have the collection of data of the patient together. And actually patients can start owning their own health data. And by owning their own health data, they can start owning their health. So I think a key point is that unique identifier. And then, of course, when building the whole data infrastructure, government needs to help in financing it, working with MedTech, think about alternative finance models. So I think those are the key points that you need to take in order to, well, to harvest from the richness that digital is going to have, and that it has potentially for us.
Right. So, can you also tell us how India is acting upon, like must act upon the learnings from the pandemic to effectively manage the healthcare crisis in the future? Some of the aspects that you believe are crucial in this regard, and how do you rate India's tackle the pandemic till now? If you can give me your comments.
Yeah. Let me say two things about the pandemic, and it's a little bit opposite. I mean, the pandemic was, of course, a very big dark cloud, and India was especially affected very, very severely during the Delta wave. However, COVID-19 has also proven to have a very strong silver lining. And that silver lining, and that's something that I see globally, but I see it actually reflected in India, is the awareness of the sector and of governments that healthcare needs to transform. So pre-pandemic, about 60% of all CEOs, we interviewed 200 CEOs, said that healthcare needed to transform. After COVID, it was 98% saying that it needed to transform. And actually 3/4 are saying that in the coming 3 years, all aspects of healthcare delivery will be transformed. So I think the good news is that COVID is an incredible accelerator for transformation, for the transformation that we needed already. But the crisis sort of, there's a sort of saying, never waste a good crisis. Well, it was a horrible crisis. We will never want to have it again. But we are harvesting all the insights, and the insights are all about the fact that we need to make healthcare more equitable and accessible. That we need not only work on healthcare, but need to work on health. So Healthy India as a mission, and making people aware of their health and what they can do to, improve their health condition. We all realize that we need to start working on the digitization of healthcare. We all realize that the key of having a strong healthcare system is strengthening the primary healthcare. What we saw in COVID, and I saw that in India, but I saw it worldwide, that during the first waves, we were bringing everybody to the hospital. Now, hospitals were so stressed and strained that we learned from it. And actually what we learned from it, that with remote monitoring and with guiding primary healthcare, a lot of patients could be brought back from home, from their hospital to the home, remote monitoring, oxygen supply, community nurses, educated, informed what they could do. And in that way, we could sort of, lessen the burden and sort of stretch it much more through the healthcare system. And then, of course, we all realized during COVID that workforce is a problem. COVID isn't solving it, but we need, and I think actually the realization that workforce is such a huge problem and we need to work together to solve it is already a very good point. How did India deal with it? I was, of course, going through all the figures, and I think, the Delta wave was horrible. That sort of put in our minds that the COVID-19 crisis has been horrible in India. Of course, it has been horrible, but India has done actually, if you compare it to other countries, it has done very well. It's having only 10 to 20% of all cases, per million of the population. And mortality, when you compare it to countries like the US, Brazil, but also Western European countries. And I think what was very important in this is the COVID dashboard that was built, and they had the war room in the ministry, and they could see exactly which areas are affected. Where do we need to send people? Where do we need to send supply? What do we need to do? So that war room, bringing all these data together, was very important. And I think the second one was the digitization and the vaccine production. I think it's admirable to see that the vaccination rate in India is really very high compared to other countries, but also the fact that India managed to step up its game, produce vaccinations, but also have the vaccination app where you could see who was vaccinated. You have it on your app. It was all organized very well. I think India was actually standing out and we're showing what it can do when it is in a crisis, and we're showing what it can do when it comes together. And I think actually there's a very positive point from that for India post-COVID is the fact that with the vaccination production, And the fact that some of the vaccines produced in the Western world are far too expensive for the developing countries. I think in that way, India did it that way and produced it that way, that India can be in life sciences and in healthcare as well, can become a real hub for that in the region, can become a real hub for that for the developing countries. So I think it was a crisis, it was a big crowd. The silver linings are the transformation that we're making, but the silver lining, I think, is also the way in which India handled it and, you know, the opportunities it gives to become a hub for healthcare and life sciences worldwide.
Nice to hear that. So, I wanted to know, like, because life sciences being one of the focus sectors of KPMG, like, what is KPMG's role for India in healthcare transformation, particularly the key focus areas you would like to focus to accelerate the transformation, which is triggered actually by the pandemic?
Let me start by saying something on a personal level, and that's what I also saw when, you know, working with the team here. I mean, everybody has to make a living. Let's be very clear about that. But the people in health in KPMG, I always say they live healthcare, they breathe healthcare, they dream healthcare, they work healthcare. I mean, it's a real passion. And the KPMG team really stepped up during the crisis. I mean, building that COVID war room, being in the offices of the government every single day, not going home for 3 months because they wanted to be there, they wanted to help. So that passion drives us. And I think, but of course, I mean, it's not, passion is great, it's important, but it's not enough. I think what we can bring to the sector in India are a number of things. I think we can help in the digital mission, of course, we can help. Like we set up the COVID war room with the dashboards, we can help doing that for the National Health Population Observatory, bringing data together and upskilling healthcare in that respect. We can help in the programs on building the medical cities, doing the infrastructure, but also linking them to global communities, building the data science behind it. We have a very large practice on workforce, so we can definitely help in what is going to be the role of the task force in workforce. PMO, coordinating, program management, but definitely also things like thinking about how can we, for example, in public-private partnerships, how can we help in finding innovative way of financing? How can we think about ways of funding where the goals of the private sector, but also the public goals are being combined in a very smart way, developing regulation and, financing systems around that. I think those are all examples that we can bring to the sector and that we are very committed to the sector, because in everything we do, there's one thing that stands out for us is that we want to improve that. And actually working together, I'm working very closely with the Indian team. We are continuously bringing all the global insights to India in the same way as we're bringing, by the way, the experience in India to the other countries.
So I think there's a lot of work for KPMG. So, going on, I would like to ask, like, how important is health and pharma domain for India? You've been speaking throughout, for all the questions, but why you think it should be seen as a national priority? Because our GDP is for healthcare is still 1% or 2%. So what are the top priorities that should be planned and targeted as India advances to a rupees $5 trillion economy by 2024 and 25?
Well, I think we need to start realizing that healthcare and life sciences are going to be enormous growing sectors in this world. I mean, globally, if we look at the aging population, globally, if we look at the number of non-communicable diseases, in India, there are about 62% of that is due to non-communicable diseases. In the rest of the world, that's very comparable. So healthcare, life sciences are going to be important. You see it, by the way, in the fact that we're now developing vaccinations for malaria, that we're now working on, bringing out, ruling out TB in this world. So it's going to be important at a global scale. What you see is that life science, especially, I mean, healthcare is very often quite a national industry. Life sciences is a very multinational, international industry, and it has been dominated by a number of players. What I now see happening is that countries like India are taking the reins in their own hands. and they're developing their own ecosystems, and they're developing their own supplies. You see that due to COVID, the emphasis on self-sustainability, taking care of what do you need in oxygen, in vaccines, in other medical appliances, that's become very strong. I think with the start of the medical cities, building out the medical cities, combining, and I think actually India has a very unique position there. If you look at AIMS, it's a unique institution in this world, combining research, care delivery, education, but also innovation, working with life sciences. I think bringing that together is very strong, and I think in India you've got very good, you've got a very good starting point. And what I noticed is reading about India, talking about India, deep diving into it. There's a very strong, innovative, entrepreneurial spirit in medtech, in life sciences. And I think actually in creating these medical cities, bringing the ecosystems together, I think India can be really big. And I think actually healthcare and life sciences can be a huge contributor to the GDP of India. And what I was just saying, I think especially India can play a role for that, not only for India itself, but also for the rest of the world. And, the African countries, the countries in the region, they all have a severe need for good medication, medtech, all sorts of other things. I think in terms of medical tourism, life sciences, it can be very strong. Just to reflect a little bit on what you were just asking about what can KPMG do, I think it might be good to tell you that we have, all based on COVID and the Ayush Bharat program from India, we have just developed the thought leadership piece, which is the 15 top priorities for transforming Indian healthcare. And that's the agenda towards 2024. And this week, while I've been traveling, I've been speaking to ministers, to very important advisors, and we've been talking about this agenda with them, and it was very well received. So that's also something that we want to do. And this is something that we do during the evenings, during the weekends, because we're so committed to it. It's riding the thought leadership to help India ahead.
Thanks a lot, Dr. Anna, for your deep insights and how the KPMG is going to work out with join hands with India and make the healthcare sector a better one. Thanks a lot for your time. Thank you.
It was a pleasure. Thank you very much.